Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over 9 very common ineffective treatment for Achilles tendonitis that used in healthcare system. It's very important to understand the normal healing cycle and how Achilles tendonitis occurs, so you know the most effective treatment to address the root cause of the problem instead of wasting your time in treatment that doesn't work. So for Achilles tendonitis, it's important to understand normal healing cycle. This has happened in the entire body. This is only one program happen in the body for your body to heal. Your body has to go through 3 stages in order to heal. I'm gonna use external paper cut for visualization, but the same process happened internally with the Achilles tendonitis. So the first stage of healing is inflammation, swelling, redness, the blood start to rush to that area. And the second stage of healing is proliferation stage. That's when your body starts to build a scar tissue, and you can see it here. And actually with Achilles tendonitis, by definition, itis is inflammation. So it's an inflammation in the tendon area, and you can see it here in this image, the redness, that's inflammation. And that usually occur due to micro tear or tear in the Achilles tendon or muscular tightness in the calf muscles that cause a strain and micro tear in the Achilles tendon, and you start to have that vicious cycle of inflammation. And your body normal healing cycle, you have to build a scar tissue in order to heal. That's the glue that torn muscle or torn tissue. If your body does not build a scar tissue in the second stage of healing, it's going to be open wound susceptible for infection. So actually scar tissue very essential for our survival. During this stage, actually the second stage, you start to have fascial restrictions, muscle spasm, and trigger point that will make the condition worse. During the maturation stage, actually that's when your body starts to heal. Your body naturally get rid of everything from the inflammation stage and proliferation stage. For chronic condition, which means that you have this issue for over 3 weeks and nothing more to relieve it because you're probably using ineffective treatment, or you have chronic condition in combination with ineffective treatment, that your body going back and forth between inflammation and proliferation stage, and it just make it hard to break that vicious cycle. So I will relate those ineffective treatment to the normal healing cycle, so it will make sense why this treatment does not work, because it's not addressing the underlying cause of the problem. So common ineffective treatment, heat and ice. And when we look at the healing cycle, ice temporarily decrease inflammation, but it's not going to do anything to break that vicious cycle of fibrotic tissue or fascial restrictions, and it's temporary effect for inflammation. Electric stimulation is temporary pain relief for any muscular pain, but does not do anything to inflammation or proliferation stage. And I will leave a link underneath this video for the study that indicate those treatment does not provide long-term result for musculoskeletal issues. So the third treatment that's very used is foam roller. And when you think about here, if you start to use foam roller on an inflamed tissue, it's like rubbing on inflamed tissue, you're gonna inflame it more. And the same concept is massage. You massage it, you're gonna rub it more, not targeting the treatment of fibrotic tissue or fascial restriction, but it's actually causing more damage than benefit. The fifth treatment that's very used by a lot of healthcare providers are acupuncture using needles or dry needling, which are actually very small needle that they use it in those areas, but needle does not has a significant effect on fibrotic tissue when you have excessive scarring or inflammation. So in order to treat the root cause of the problem, we really need to look at it from inflammation and proliferation perspective. Joint mobilization, which is actually moving the joint by itself, And actually, when we look at the healing cycle, the problem is actually in the musculoskeletal. So moving the joint is actually not really relevant to the Achilles tendonitis, because the problem in the muscular tendon system, not the bone. So the other common treatment is stretching, and I personally avoided stretching for the last like at least 10 to 15 years with my patient, because the studies show the stretching cause more inflammation and overstretching could cause more damage, and that's totally opposite to anything you see in YouTube, because everybody say stretch. When I went to school, the first thing is stretch your calf, stretch your calf. When we look at the healing cycle, that does not make any sense. When you have a torn muscle and you keep stretch it, what's going to happen? You're going to tear it more. Does not make sense. But when we look at the studies, it's actually cause more inflammation. So when you cause more inflammation, you're going to cause more fibrotic tissue, more scar tissue, more fascial restrictions, and that actually will cause more symptoms and make it worse. That's why I personally do not give my patients stretching. There's other safe options to address the root cause of the problem without causing more complication. The other common treatment is strengthening exercises during the inflammation stage, which does not make sense because you are very inflamed. You doing strength exercises will cause more inflammation. I personally do not do the strength exercises during the inflammation stage, and then actually more effective than the strength exercises is function training, correcting the biomechanics of the foot. I will leave a link underneath this video for the 3 most powerful and effective treatment to treat Achilles tendonitis. If you have any question or comment, leave it in the comment section and I will answer it in the future video. See you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to astrinstitute.com.